Hey gang, welcome to another version of Wisdom Wednesday. We have a pretty special one this week. First thing I want to mention Alicia Smith, one of our great dental assistants. This is her last day. She's leaving to move back up near the Fort Worth area because all of her family's up there. She's one of my two-timers. She worked for me for 1.5 years, and then she left for what she thought was greener pastures for 1 year, and then she came back, and she's been with me for another 1.5 years. A lot of our patients love her to death and don't want anybody but her assisting with them. My team loves her too, so we want to wish her the very best in her next life. So. Okay, see you. Okay, so good luck to Alicia, and come see us very soon to see how we have found replacements, and we have 2 new dental assistants starting in about 2 weeks. So you'll have to come and meet them and see how we're growing the ADS team. Secondly, this, of course, is the last Wednesday of Movember, Mustache November. This baby is going away starting Friday morning. So it'll be the end of November, and I guess I've proven to myself and the world that I can still grow facial hair. Not really crazy about the color of all of them, but anyway, it was a fun cause at my age. To be able to be a rebel with a cause is a lot of fun, and we had fun doing it and explaining to people why I was doing it. If you didn't know, Movember, which is over tomorrow, has become a men's health month issue, so that people grow facial hair in honor of, started out as men's prostate health awareness, and it kind of morphed into testicular cancer awareness thanks to Lance Armstrong, and suicide prevention awareness, and just other men's health issues in general. So and this is my lovely assistant Brandy, who grew some facial hair just to match me for the month. So just to be supportive, and that's the kind of people we have around here. So we have 1 more day left on our promotion this month. If you hashtag ADS Movember, ADS MOVEMBER, on Twitter or Instagram, you enter the contest. It's on Facebook, okay? I thought it was Instagram. Yes. But okay, Instagram or Facebook, hashtag ADS Movember, and you enter our contest, a photo of you with facial hair. And we are giving away a $50 Starbucks gift certificate to the winner of the most creative or the most facial hair. We'll decide. We'll know the winner when we see it. No armpits, please. Anyway, that promotion ends tomorrow, and we have some surprises starting next week for December for our contest. So stay tuned. Look forward to that. And our health tip this week, we have the biggest health tip. I'm reluctant to even show you this because this keeps me from being able to do as much dentistry as we could before people discovered these things. This water pick, I think my dad probably had the very first one that was made back in the 1960s. Me and my brothers used to shoot each other with it as one of them was walking by the bathroom door. Unfortunately, you could hear them start up back then because they sounded like a small lawnmower. And now they've gotten much more sophisticated. The tips are better, but single-handedly using a water pick, we've had 2 people come in this week, which is what made it the health tip of the week, that had bleeding gums when we first met them, and they bought a water pick and they actually plugged it in, filled it up with water, and used it, which is an important part of the deal. It is one of the messiest gadgets that you'll have in your bathroom, but and we won't go there, but you have to keep it in your mouth while it's on, because you will redecorate the bathroom. If you don't like the wallpaper in the bathroom, then turn it on and just use it, because it is like a power washer for the mouth, but it gets down where nothing else that we have, dental floss included, gets, and it will pretty much single-handedly stop your gums from bleeding within a week at the longest. So if you have problems with bleeding gums, health tip for the week is get a water pick. We sell them here. You can buy them at Costco, Walmart, CVS, anywhere. They're very readily available. So that's the health tip for the week. Now, we had a winner this week, this month, our most creative check-in. Tara Kessler. I know there's 1 day left in the month, but because I run the contest, I decided the contest is over today, because I don't think anybody's going to outdo this. Tara Kessler's check-in yesterday was on Snapchat, and I think we might have made her teeth just a little too big. She is a beautiful woman, but we had a great time posting that, and so she is the winner. Her choice, a water pick or a Sonicare toothbrush, which we are giving away monthly for a creative check-in. So second order of business, our own Dr. Jordan Slagter is featured in Austin Monthly Magazine and Austin Woman's Magazine with a holiday ad with her golden retriever, Oliver. So check it out when you see Austin Monthly Magazine or Austin Woman Magazine on the newsstands, because we're loving that she was willing to subjugate herself to have a photo taken of her, and it turned out beautifully. And our own Annika Franco did the photography. She is great. We got a surprise coming for you in January as for the model for the next shoot. And last but not least, I want to bring up a subject that has come up a couple of times just this week. We had a couple of new patients come in that were looking for sedation options for dentistry because they have neglected their dental care for the last 10 years on average because they were afraid of dentistry. And then they heard that we do quite a bit of sedation, and they wanted to know what their options are. So I'm going to give you a quick rundown, the Cliff Notes version. There are three main categories to sedation dentistry. The first one everybody has heard about or knows about. Some people have experienced it both in and out of the dentist's office, and that is nitrous oxide or laughing gas. In high amounts, it can make people laugh uncontrollably. We don't get that high of a concentration here in the dentist's office, sorry. We aim to just take the edge off, make you a little more relaxed and comfortable than you would be if you weren't breathing the nitrous oxide. It is a wonderful drug, and it helps for a lot of people. You breathe it through your nose, through a little nose piece, and it only takes effect while you're breathing it. Towards the end of the appointment, we turn it on pure oxygen, and people are safe to drive home, go back to work, do whatever. So it's a very effective and very frequently used sedation option in dentistry, probably the most frequently used. The second option for people that need a little more sedation than that, or that have a greater anxiety level, there are two drugs, Ativan and Halcion, which both were originally on the market as sleeping aids, and Halcion got famous for a while when senior George H.W. Bush went to visit the Prime Minister of Japan, and he took Halcion on his plane trip over there so that he could get sleep patterns the same as what they were going to be when he landed in Japan. But it also upset his stomach, and probably some of that Japanese food that they were feeding him didn't help any, but he barked on the Prime Minister of Japan. That was probably 15 years ago. So they took Halcion off the market as a sleep aid because people were driving 70 miles an hour down the highway and all of a sudden had amnesia and forgot where they were going because they got such a good night's sleep, I guess. But we picked it up in dentistry because we found out that's exactly what we want, is them not to really remember that much about that appointment that day. For about 2 to 4 hours, you're going to be pretty sedated, pretty much out in left field. With either Ativan or Halcion, you need to have somebody drive you to the appointments and drive you home, and you got to take them on an empty stomach to have any chance of them turning out well. And I don't want to be like the Prime Minister of Japan. Those are great options. They probably 80% of the sedation that we do that's not just nitrous oxide is Ativan or Halcion. But there is that special little 20% of the population that even Ativan and Halcion don't work for. They either gag easily, or they're terribly afraid of dental appointments, or they need a good bit of dental work done, and the appointment's going to be 3 to 4 hours. And those people, a lot of them choose to have a dental anesthesiologist come in. We have 4 of them in Austin at last count that are all excellent. They come to the office by prior arrangement, and they will start an IV usually in your wrist or the back of your hand, and you will go to sleep. Just like having your wisdom teeth taken out or minor surgical procedures in a surgery center, you are not going to be awake. You're not going to remember anything about your dental visit, and when you wake up, it's all done. So that obviously a little more expensive, but it's very, very effective, and it's something that a lot of people, probably nearly one a month, choose that option because they want to get their dental treatment done, or they got to get their dental work done, but they don't want to remember the experience at all. And so it's a very effective way. My older brother is a heart surgeon in Houston, and on several occasions he has said, I can't believe you do all the stuff that you do when they're awake and looking at you. All of his patients are asleep. So it's all in your perspective, I guess, and what you're trained with. But come see us if you've got anxiety about dental treatment, or concerns about pain level that you might experience during the treatment. We have solutions for you. So come see us at Austin Dental Spa. Thanks for tuning in to another version of Wisdom Wednesday, and I'll look forward to seeing you without the mustache next week, the first Wednesday in December. Bye.